are statements describing a suspected problem for which additional data are needed to confirm or rule out the suspected problem. It provides the nurse with the ability to communicate with other nurses that a diagnosis may be present, but additional data collection is indicated to rule out or confirm the diagnosis. So in my own opinion, I think this possible diagnosis starts as a risk diagnosis. So when the signs and symptoms manifest fully, it now becomes the actual diagnosis. So a syndrome diagnosis is a clinical judgment concerning with a cluster of problem or risks nursing diagnosis that are predicted to be present because of a certain situation or event. That is, syndrome diagnosis is drafted from incidents of life like rape, trauma, example, rape syndrome, post-traumatic syndrome, and the rest. The last one is the health promotion or wellness diagnosis. Is a clinical judgment about motivation and desire to increase wellness. It sees to the transition from a specific level of wellness to a higher level of wellness. So the features or components of health promotion diagnosis include only the diagnostic label. Medical diagnosis and nursing diagnosis are not the same thing. So we'll be talking about the difference between medical and nursing diagnosis. The first tip is that nursing diagnosis can be a mental, spiritual, psychosocial, or physical. It is kind of holistic. It focuses on the overall care of the patient, while the medical diagnosis involves the medical aspect of the patient's condition only. Nursing diagnosis changes as the patient's response change, unlike the medical diagnosis which remain constant throughout the duration of the illness. Nursing diagnosis specify actual or potential health problems of the patients or clients. Nursing diagnosis does not require a medical referral, and nursing diagnosis is not a medical diagnosis which describe pathology. It is not a surgical procedure, nursing action, or nursing therapy, or medical tests. It just deals with human response, that is that of the patient. Guidelines on how to form nursing diagnosis. Tip 1. Avoid writing a nursing diagnosis in terms of the patient's need. Instead, it should be written in terms of a response. Example, need for fluid intake, which is incorrect. The correct one is deficit fluid volume related to nausea and vomiting. The second tip is do not relate a problem to a medical diagnosis. It's not done. Third tip, avoid repetition of nursing diagnosis, e.g. anxiety related to the fear of the unknown. It is a tautology. This is two or different nursing diagnoses which can be written separately. Tip number 4, it must be arranged in order of priority from the most threatening ones to the one that is non-threatening ones. When writing a related factor, do not use due to. So instead of using due to, you can use related to. That is the most acceptable one used. Another important thing to note is that you have to specify the second part of the general response or label to make it more precise and understandable. Like if you have acute pain, you have to tell us where the pain is, as in where the pain is localized. Okay, let's use this example. Impaired skin integrity. you now put in brackets right anterior chest. So the impaired skin integrity is localized at the right anterior chest, which is